we're going to have a look at Jesse's range of motion. So if we get you to turn side on again, Jesse. First range of motion I'm going to have a look at, I like to be sitting down behind the athlete, holding on to their pelvis. And we're going to ask Jesse to bend forward, try and touch his toes, keeping his knees straight. So looking to see whether there's any pain or problems with lumbar flexion. If you get to stand up tall again, Jesse. It's a good way to quantify that is to have a look at where the fingertips reach. So I'll write the athlete is able to forward flex until the fingertips reach the ground. The athlete is able to forward flex until the fingertips reach the ankle joint line. Then I'll ask him to extend his lumbar spine, so lean further back over my thumbs there, Jesse. So looking to see if there's any pain or problems. So no issues with that. I'll then take the athlete into extension with right-sided and then left-sided extension, seeing whether those movements are also provocative. In general terms, pain with flexion, I think you typically see with discogenic pain, and pain with extension, that's making me think more about a pars defect, although those are not hard and fast rules. While the athlete's lying in a supine position, I think it's also a good idea to assess hip range of motion and see whether there's any evidence of a hip pathology. We can also do a figure 4 or FABER test where the athlete puts their foot on the contralateral knee and lets the hip drop into external rotation. So this is a non-specific test but can cause pain in athletes with SIJ pathology and athletes with pars stress fractures because it applies some extension force and rotation through the facet joints and posterior elements. Having done that, we'll get Jesse to roll over into a prone position, so onto your tummy. In this position, we can do a Mennell's test where we hyperextend the hip while our hand is stabilizing the lumbar spine. This is a test that's been demonstrated or documented to cause pain in athletes with lumbar spine pathology like a pars defect.